Hi everyone, this is Dr. Viet Lee from the Academy of Online Radiology Education. I work at Cincinnati Children's Hospital Medical Center in Ohio. I would like to thank our senior editors for their contributions to this month's Pediatric Radiology blog, Dr. Paul Gillerman from Texas Children's Hospital in Houston, Texas, and Dr. Alex Tobin from Cincinnati Children's. We are very excited to share the current literature in pediatric radiology with you. Pneumatosis intestinalis after hematopoietic stem cell transplantation, when not doing anything is good enough. This is a retrospective study from 2008 to 2019 that evaluated the significance and management of pneumatosis intestinalis in patients who received hematopoietic stem cell transplant. The study also describes the clinical presentation of pneumatosis intestinalis, including the time of diagnosis after transplantation, symptoms, and time of its resolution. The authors conclude that conservative management of pneumatosis intestinalis in transplant patients has been largely successful, and relevant clinical symptoms, rather than its presence or absence, should guide clinical decision-making. Use of small bowel ultrasound to predict response to infliximab induction in pediatric Crohn's disease. This is a prospective study that analyzed the utility of small bowel ultrasound as a non-invasive tool to evaluate induction response to infliximab in Crohn's. The study describes changes in small bowel ultrasound parameters before and after induction therapy. It also looked at how these parameters are associated with clinical and biomarker response. Small bowel ultrasound showed decrease in bowel wall hyperemia. It also showed a decrease in the length of the bowel segment involved after induction, which was moderately correlated with decrease in fecal calprotectin at 1 week. The authors conclude that small bowel ultrasound is a feasible tool to assess post-induction responses in Crohn's disease. However, the study's small sample size and lack of more longitudinal follow-up are major limitations. Use of breast imaging reporting and data system, BiRADs, ultrasound classification in pediatric and adolescent patients overestimates likelihood of malignancy. This retrospective study evaluates the validity of the BiRADs ultrasound classification for malignant breast lesions using histopathology as the gold standard. The study demonstrates a 100% false positive rate for BiRADs 4 and 5. No malignant breast lesions were present in the study's population. The authors found that the use of BiRADs in the pediatric and adolescent population to categorize breast lesions on ultrasound severely overestimates the risk of malignancy. If used, the associated BiRADs recommendations for biopsy should be disregarded, as the extremely low incidence of breast malignancy in this population often precludes the need for tissue sampling. Echocardiographic findings in pediatric multisystem inflammatory syndrome associated with COVID-19 in the United States. This is a retrospective study from April to June 2020 that describes the anatomic and functional echocardiographic manifestations of MISC compared to healthy patients and compared to patients with classic Kawasaki disease. The authors show that the coronary arteries may be spared in MISC compared to Kawasaki disease. However, cardiac dysfunction may be more common in patients with MISC. Atypical pulmonary metastases in children. Pictorial review of imaging patterns. This is a pictorial review of the imaging findings of atypical pulmonary metastatic disease seen in children. The article includes a variety of examples of atypical pulmonary metastases from common primary pediatric cancers. The authors highlight the importance of recognizing these atypical patterns in order to avoid underdiagnosis and understaging. CTA utilization for evaluation of suspected pulmonary embolism in a tertiary pediatric emergency department. This is a retrospective study from 2005 to 2017 that evaluates the use of CTAs for suspected pulmonary embolism at a single center. The study shows that utilization of chest CTA for PE evaluation increased by 3.2 studies per year, though the overall rate of PE diagnosis remains stable over time. Limitations include the retrospective nature of the study design and limited clinical data, such as lack of imaging review and exclusion of outside CTA studies. Mechanical endovenous ablation of varicose veins in pediatric patients with Klippel-Trenaunay syndrome, feasibility, safety, and initial results. This retrospective study describes the use and outcomes of a more recent technique, endovenous mechanical-chemical ablation, or MOCA, in the treatment of embryonic and dysplastic veins seen in patients with Klippel-Trenaunay syndrome. The authors achieved technical success and primary occlusion in all 13 patients, which lasted for 1 year. The rate of partial recanalization was 18%, and the rate of adverse effects was 0%. The authors conclude that MOCA is a safe and effective treatment in their study population. Management of hydrocephalus in children. Anatomic imaging appearances of CSF shunts and their complications. This is a detailed educational review article of pediatric hydrocephalus with a focus on the management. The authors describe the anatomy and mechanisms of CSF shunts and provide sample CT and MR protocols to evaluate hydrocephalus and CSF shunts. They also include a review of shunt complications and a brief description on shunt revision. Improving image quality and reducing radiation dose for pediatric CT by using deep learning reconstruction. This is a retrospective study using data from CT exams performed from February to December 2018. The authors evaluate a deep learning reconstruction algorithm called Advanced Intelligent Clear IQ Engine from Canon Medical Systems with regard to image quality and radiation dose reduction. This deep learning reconstruction algorithm is compared to existing methods, including filtered back projection, statistical-based iterative reconstruction, and model-based iterative reconstruction. The authors show that deep learning reconstruction algorithm improves image quality and has greater radiation dose reduction potential. Thank you so much for listening. For more details, please visit our blog where you can also find the links to the original publications. Feel free to share your thoughts and questions on the Pediatric Radiology Forum. See you next time.